everyone. I'm Devashish. I'm a second year here at Keenan Flagler, and I'm super excited to be here, not because I'm facilitating this, okay, maybe just a little bit, but also because we actually have a superstar amongst us today. So we have Amrita Bhowmick here, who is actually the founding team member of the Health Union. Now, I won't take too much time speaking about her, but let's hear more from her.
Thank you. Now, I was just thanking Mike for running over because talking about myself is probably the thing I like least in life, so you're going to have to ask me some questions. But Suzanne allocated, I think, 30 minutes, which is a very long time, and I don't intend to take all that time. However, please feel free to ask questions. So I think part of the level of interest was my background is a little bit of a non-traditional route. I've never thought of it that way because I just kind of do my own thing, but it probably is considered a little non-traditional. After business school, I went to work at GlaxoSmithKline. And the fun fact there is HR actually rejected me 6 times. I feel like you always see the shiny stuff and not the stuff behind the surface. However, I had written a business plan while I was in grad school that focused on a new drug development. So I used that to kind of get my foot in the door, find marketing people that did want to hire me, had to circumvent HR many, many, many times, got my foot in the door for an internship, and I was hoping to do their management development program, which was canceled the year I started as an intern. So I found some senior executives and an HR person that were willing to sponsor me. So I spent about 7 years there. I did the management development program for product management, which was sales, market research, marketing for about 2 years of that time. Was fortunate to have the ability to launch 3 new drugs, so diabetes, antibiotics, as well as hematology and oncology. But the coolest thing is while I was there, I kind of knew I was never necessarily a corporate person, but it was wonderful experience, wonderful networking, and I love the discussion that you just had because it just speaks to how complex the healthcare system is. And when you're looking at it from the outside, it's really hard to know. And so being an idealist, I went in and then I was like, wow, this is very different from what one might think, especially in fields like oncology. So while I was there, I met some colleagues. We left to start Health Union. That has now been 15 years ago. Health Union is a company that owns and manages now over 55 health communities in 60 conditions. We launched in 2010 and had a private equity exit back in 2020. I stayed on for 5 years after that. So I was chief community officer to start. I built the model that we scaled and replicated across those communities. My team went from just me to 800 people in, I think, 8 years. I stayed on then as chief strategy officer for a couple of years, working specifically on M&A. And then at year 15, I was like, you know, I always say it was a third of my life, and it totally dates me because it tells you how old I am. But I was like, it's probably time for a change. So at 15 years, I transitioned to a consultancy role for my exec role. And now I still work primarily on M&A, working on exit strategy for the company, but also started ramping up my times at the Gilling School of Public Health. I joined Eshelman Innovation, helping them build out a new digital venture studio, which is actually just launching in the fall, spending a little bit more time here as well. And academically, so I did my MBA. While I was at Glaxo, I was just fascinated by the fact that we do all these things kind of to patients and at patients, but patients are really the afterthought. So for instance, even thinking about engaging patients in the clinical trial process, there isn't a lot of thought that goes into it till phase 3. When you're in marketing, you're kind of like throwing a drug and it's like, let's convince patients that they want it, as opposed to thinking about that earlier in the development process. So while I was there, I went back and I got my MPH while working. And then while I was at Health Union a few years ago, I went back to school to get my doctoral degree in education, focusing on social learning theory, which really translates to a lot of the stuff that I did. That is it in a nutshell. Hopefully you're all still awake.
Well, that was really good. And so my next question would be, so our session is called Healthcare Innovation and Venture Development. What is that from your perspective?
Yeah, so Devashish showed me the question a second ago, and I was like, I don't know how to answer that. So I think for me, venture development is anything where you're taking it from 0 to 1, which for me is honestly the most exciting thing. And so that's like the cruel irony of Health Union is that we've been extremely successful financially, but the bigger we get, like past 50 million is less exciting to me. And that's the cruel irony is like you make it and then it's a totally different job. So for me, the venture development part is definitely the 0 to 1, taking something that did not exist and actually like building that in a way that's new. But healthcare innovation can apply anywhere. It can apply to large existing systems, making small tweaks that have big results, making small tweaks that have small results. But really, it's just the idea of doing something differently. But don't consider me the dictionary definition on either of those, because I just made it up on the fly. So.
No, that's actually makes a lot of sense. Now, we heard about your career journey, and that's super interesting and how you have charted your course. But what does a day in your life look like?
Yeah, so I guess I can give you kind of 3 snapshots. So when we started Health Union, for any of you that are interested in startups, I love startups. It was just kind of chaos. So it was long days. I also moved 3 times, built a house, had a baby, and started this company all in the same year, which I don't recommend. There was a lot of crying. So it was an interesting year. And so there was just like, you just kind of do whatever needs to be done. And I will tell you, it's a story for another time, but what we thought we were doing when we launched Health Union really morphed into something very different. So the core idea of patient engagement and leveraging the power of the internet and social networks never changed, but how we executed changed many, many times. And so there was a lot of iterating along the way in the early days, and then it really transitioned to managing a really large team of people, which is cool, and I really enjoyed kind of building the scale, building the infrastructure, but it turned into a lot of like compliance and HR and finance and talking about EBITDA and things that you folks in finance probably love, but I was like, this really just does not make my heart sing. So as the team got bigger and the company got bigger, the job really changed. I will say transitioning over to the strategy role, I actually loved working on M&A, which I did not expect at all, but just the idea of looking at, I think the idea is like you really are looking at innovative things, you're looking at smaller companies that are doing things very differently and trying to figure out how do you fit those puzzle pieces together to create unique value. And even though, 9.5 out of 10 times it does not work out, so you're just doing a lot of work that yields no tangible results, you're learning a lot, which was really cool. Now I kind of whack a lot of different roles, so I spend some time at Health Union helping them manage the company from a high level, focusing on exit strategy, focusing on strategy of the company, investment, operational design, restructure, et cetera. And then most of my time, I also spend time at Gillings. I just brought on my new MPH students. I don't see any here, so I don't think any of my students are here, working on the capstone for their consultancy problem, and then working at Eshelman, recently spending quite a bit of time building out that digital health venture studio. We're actually kicking off our first sprint next week, which is exciting. So talk about building 0 to 1. That plane is very much being built as we're flying it. So that has been a stressful but fun process as well.
Thank you so much. That was really enriching. All right, now for everyone, we really have a very interesting case. Super excited for this. So can we have some drum rolls, maybe? Awesome, this is a nice group.
Not yet.
All right,
okay,
so.
Cool. Do you want me to do it, or you want to do it? You
I want you to
do it. Like. I would love to hear myself talk less. Okay. So I think what's actually so exciting about this is the fact that it's kind of unsexy in a way. So when you think about health innovation and the stuff you hear about, it's always like cool AI tools, rare diseases, oncology, specialty care, and that's the stuff that really gets a lot of noise, particularly in like the business press, if you will. But the core of what healthcare is primary care. So I know we have one provider in here and one Canadian in here, and I'm sure those two people agree with me that like having really good primary care is something that yields the best outcomes. And you just talked about planning for end of life, hospice, et cetera. All of this kind of fits in the same bucket of just providing like good basic healthcare. So I thought this was kind of cool because it is like an unsexy part of healthcare that we don't think about, but it's something that's not really working well, which means it's ripe for innovation. And you just thinking about how we can do things differently. So I thought I would pick on the men because there's some low-hanging fruit there in that men just don't go to see their primary care doctors. I am actually married to a physician who does not go to see a primary care doctor. So we know this well. There's a lot of different reasons, which we'll get into, but you can see the numbers. I mean, you guys can read. I'm not going to drone on about this. But the fact that they don't even like talk about their healthcare, and that's more than half of men. So it's just not something that's top of mind, which is an interesting basis to start with. So why is that? Again, you can read all the words, but thinking about just the individual barriers that might exist, but also thinking about sociocultural barriers that might exist. This is something that we talk a lot more, I would say, on the public health side of things and the business side of things, but drives a lot of patient behavior. And then, of course, thinking about the structural elements, which you just spoke about in the last session as well. So what are those causes that are resulting in people not seeking primary care at baseline? Probably the most interesting section of this slide, I think, is the considerations and constraints. So two things just to keep us grounded is we are focused on the US market. So the idea is that you're thinking about a US-based program that can then be scaled throughout the rest of the country. And of course, you have to maintain basic HIPAA data privacy laws. Data privacy laws are very complicated and different by every state, but just make the assumption that you need to keep data private and have to be very careful about selling it. But what's interesting is that, so we're also facing a physician shortage, but this is actually specifically primary care. So there'll be a primary care physician shortage, at least 86,000 in the next few years. Also interesting is that primary care is often a loss leader, so it's very hard to make money in primary care. Like Warren Buffett has tried it, Amazon is getting in there. A lot of people have tried. It is really hard to make money in primary care up until now, particularly as like a standalone organization. But I think there's some cool opportunities now, which is why we're doing this case to do things a little bit differently. And then, of course, we know that at least 1 out of 10 folks are uninsured, and about a quarter are underinsured, which means they don't have enough coverage to pay for care appropriately. So, any questions about just that side of the slide? Everything good? Blink. Okay. Cool. Thank you. Okay, so your mission, and I think you all know how you're breaking up into teams, because I don't, so I will just let you do whatever you've been doing unless someone wants to do something different, is to think of some kind of, it has to be a for-profit, so it can't be a nonprofit, which is actually much easier aside from the fundraising standpoint. So it has to be something that is a for-profit or hybrid, so there is a revenue component of this and there's a profitability component of this. Think of a solution that is leveraging digital health to drive engagement in primary care among men. So there's some examples here. Please don't feel pigeonholed into those examples, but some things to consider. So obviously you need people to use this tool. And I think one of the most interesting things about healthcare is that oftentimes the people that are your users are not your payers. And so you kind of have like many masters to please, if you will. So how will you actually generate utilization? How are you going to get past those barriers that we talked about, sociocultural barriers, individual barriers, structural barriers to drive that utilization? What are the partnerships? That is like a big hint. I know you just talked about partnerships as well, that will help accelerate adoption, but may also help mitigate some of the revenue profitability concerns that exist with primary care. And then how will you make money? Which is just a basic, and how will you do that in a way that's scalable? So again, like primary care sounds like such a basic thing, but when you look at the constraints and what's actually happening, it's one of the toughest things. However, it is a thing that if we can do better, could have one of the biggest positive impacts on us as a society and the healthcare system as a whole. So any questions about that? Is it pretty clear? I don't know the answer, by the way, so I'm scared you're gonna come back and ask me questions and I don't know. Actually, no, that's why I thought you guys would figure this out. But there clearly is no great solution, which is why we're in the situation that we are in. But maybe you'll come up with something cool, or if nothing else, maybe you'll just get some ideas cooking. So yeah, please.
The financial challenge, how much money can we spend?
For the financial, so it just has to be an idea that's profitable. So assume that you have some investment, but whatever the investment is, you need to be driving more revenue than what the investment was up front. So.
And you have 15 minutes. My one tip, there were a lot of single gender groups. Since this might be about men, you might want to think about having a male representation in your group. So you can switch up groups. It doesn't have to be the same group. So you might have to hunt around and find a gentleman. All right.
As you are getting to your seats, we're going to go ahead after this to move through to get lunch. But what I do want to say, there's some people in here that I would suggest sitting with and meeting. First of all, Richard Combs over here. He is with our EENR employer. Is it still EENR? Or tell me what you guys are.
Technically EERO. You can just say.
Okay, employer relations. So you can learn a lot about the ecosystem of careers out there in the business of health. Barbara, I hate to tell her, but she's Barbara Senich has many, many years in the pharma industry. Plus, she's just a great support person. I think she's a terrific mentor, so get to know Barbara as well as all of the students and our guest speakers who will be staying as well. But there must be some more people somewhere. Are they still out there? There is another class down there too, so.
Significantly less. By the time you got the third pair, you'd be looking at.
For sure. I guess the question is like in terms of.
Okay, so I think we have about everyone.
If you want to say like, hey, we're with discounts for you, major discounts.
Oh, because I don't know if we'd be able to get the returns because of the margins of the ticket costs already. I will say the other tough part is getting your first client because they're going to be like, we want data to see that your product is effective. And you're like,
incentive to get the
so that's like where you probably have to
use it so fast. But I didn't see it if I'd done best.
you know, is there a
best I would have
Still looks like people are missing, but we're gonna start moving along. First of all, also before going to lunch, here is the game card. First of all, there's a duplication in there, so you can just cross out one. Secondly, there's a misspelling, so you gotta correct the misspelling as well. But just sign your name, see at the bottom here. You can tear this off and I'll collect those because in all honesty, you're probably gonna keep these because this is really a great resource for you to have, but complete as much as you can with your groups at lunch, turn them in, and we've got some swag gifts for the people. I'll pull out a few folks. So what I think we're gonna do is we're gonna finish up, we're gonna do the next 10 minutes here. I'll do about an hour, let's say, it's 12:30 to 1:30. I had an hour and a half for lunch, but that seems excessive. So I say an hour for lunch, then we're just gonna meet back in here. I'll do the drawings, and then you guys are free a lot earlier than you thought you were gonna be today. But I'm gonna welcome Amrita back up front, and we're going to see what contributions you all have.
Do you envision me going to the next slide first or at the end? We should have discussed this before and I didn't.
Oh, sure. I'd say let's.
You want me to share first?
Yeah.
Okay, that's what I was gonna do. I just wanted to make sure. So who has an idea or a half-baked, I love half-baked ideas, they're actually the best. So half-baked ideas or full idea, yeah.
We were thinking of some sort of like gamified way to get people to go to their primary care physician. So I don't know if you know about like the app Diet Bet, but essentially people pay some amount of money. They bet on the fact that they'll lose X amount of weight in a certain amount of time. Yeah, and then they, like some people achieve their goals, some people don't, and then like money gets distributed that way. So we were thinking some sort of like subscription model where you have certain tasks you need to do, like, I don't know, like run a mile, and you get some number of points, or like the final boss would be like go to your primary care physician, and then you move up some amount on the leaderboard, and that leaderboard would be publicly available, so it's really a competition. And with the pooling of money, if you're like top 1, top 3, whatever, you get some amount of money back.
Very cool. It's funny because, so B2C is always hard because you're like wrangling for every individual consumer. But we did something very similar at Health Union where we did it for employees. So think about going back to the partnerships, like how you could partner to do that at scale more rapidly. So I think we gave out Apple Watches, if I'm not mistaken, and it was literally just to go see your primary care doctor. And if you did that and you were on the company health plan, you got put into, and everybody went, which is wild because we have like mostly young people who aren't going to the doctor. So gamification is always good. I don't know how I feel about the diet example necessarily, lots of mixed feelings there, but conceptually, very yeah.
So we talked about like our target audience being like Gen Z, and like partnering with like brands who are a part of like the trend or the culture. So like a Gymshark partnership or something like that. We don't know how that would work for revenue for the company. So it's like a half-baked idea, but doing something with like a partnership with like a Gymshark, and then providing incentives like, say you go to your primary care doctor, and within the time frame that you visit, if you visit at least twice within like 12 to 14 months, then you get a free protein plus like Gymshark brand stuff. I don't know how that would work, but something like that.
Yeah, no, I love that. And like specifically, so our health union, I didn't talk much about the community model, but the idea is just leveraging people who are already engaged online and giving them a pathway to engage in a more specific way to learn about their condition, social support, et cetera. But the core of the model is we call it the meet people where they are model. And it was based on the fact that so much of healthcare is focused on patients having to come and engage. So I love your idea because it goes back to like meeting people where they are. They're already at the gym, they're already engaged. And there's actually some cool like educational models around translational learning. So if they're already doing and going something, you can just help them pivot into something new, which is really a cool idea. Yeah, you guys can choose who goes first.
Okay. Yeah, so our group was kind of talking about the aspect of educating was kind of like big barrier, and a lot of men, like there's a lot of focus on women's health, but like less focus on men's health and kind of the media playing into that. So like similar along the lines of like utilizing like influencers and kind of like promoting their brand, but also tackling like meeting men where they kind of go a lot, which as you mentioned, the gym. So we were saying like having like almost like a station that you could like walk up to, plug in some stats, you know, and almost like scan and say, okay, you should go see a doctor for this or go see a doctor for that. So kind of something along those lines of meeting them where they go, essentially.
Yeah, I love that. And you can pair it up with this gamification idea probably and figure something out there. But love that.
Yeah, so our team was thinking about, like, since we are discussing the US men, mostly the US, I mean, the demographic goes through the blood pressure, heart attack, and all those diseases. And when we are talking about US demographic and gamification, NFL comes to picture. So what we thought of creating a gamified version of NFL that's like a monthly, you go ahead and play that game, and you at the same time wear your wearable watch. And that gamification version, it stimulates the real stress in the real time, and your biometrics get loaded in the device. And through that, the AI model kind of nudges you to get tested if the biometric is somewhere in the outliers. And we are planning to do the partnership with the telehealth, because it will be a B2B model, so that we are directly not consumer focused but a business focused. And I feel the revenue will also flow from that model. And which barrier that we are addressing here is the fear of going out and actually getting tested, whereas you are just here playing the game as a regular day-to-day.
Like passively providing your, and what's interesting is like, so we've done some work with Apple Health through Health Union, and they're very much a tech company, and what I find to be interesting is their technology has the ability to do a lot of things for healthcare, but they don't necessarily see all of those because they're not necessarily a healthcare company. And so there is a huge opportunity to develop something using all the features that they have to do something really cool to drive patient engagement. They don't necessarily think about users and patients in the same way that you would from a healthcare perspective, which leaves this opening for opportunity. Cool. I thought I saw a hand over here, but maybe I didn't. Anyone else have any? Someone from this side, you guys are like ready for lunch. Everyone's scared I'm going to pick on them. Okay, yeah.
A little, I mean, related, but not directly. I'm in the career services space. Can you elaborate a little more about when you told your story, how the development program was canceled and then you were able to find a senior sponsor, and kind of like that story of resilience?
Yeah, so, and we had talked about this a little bit offline, but it was interesting because, so to get the internship, I had several people actually offer me an internship, and then I kept getting blocked by HR because I went to Temple and they were only, in the city of Philadelphia, they would only recruit students from Penn. And it was just like, literally this like operational, like we cannot put you into the system in HR unless you've come from this one specific MBA program. And so that's when I learned like, it's just like an operational fight that you have to fight, if you will. And so just a good lesson learned to like find your way around if that happens. And so I managed to get my foot in the door. They did cancel the program. And then I found, it was actually the head of US Pharma at the time, and I had said, I came here, had this business plan, I worked as an intern, I really want to do cool things, and I don't know how, I just got really lucky, I think, but I will also say, I'm like ashamed to share this, but you should know, I also did like stand outside his office every morning for 30 minutes for a week. To the point where his admin would be like, Amrita, it's so nice to see you. And I was like, hi, Judy, it's nice to see you too, because you could not get on the man's calendar. And so, I asked her a few times the prior week, and she was like, I think your best bet is to like, just hang out here. He's usually here at 8 o'clock. So I was like, cool, I'll see you at 7:30. And so I literally just hung outside his door and was able to get him between like 7:45 and 8 o'clock. And maybe that's what did it, I don't know. But he then tossed me over to like the head of HR. So I wasn't dealing with the recruiters anymore at that point. And they figured something out to get me into the program. Also, there was a need, so I knew there was a sales team. Sadly, one of their team members was out with ovarian cancer, so they needed to fill the spot. So for them, I was like free labor because the headcount came from somewhere else. So I was kind of like, I could do that, and then I could fill the market research roles. And like, there was a pregnant person, so they could put me there. And then I'm covering for the pregnant person, so I kind of like pieced it together, and he was sold. So I got very lucky, and I was very lucky to have people that were willing to help me. I also stalked a lot of people in maybe questionable ways.
Any last questions? Again, I think thank you, Richard, for that one. Any last questions, curiosities? Again, too, the innovation area is, to me, just exploding. So I think it's in everything. We have innovation in hospital systems. We have innovation in pharma companies and payer companies. You name it, they have innovation departments now. And so this is where you can use multiple skill sets. Again, coming to places like these to learn a little bit more about healthcare, but meeting people. Again, you've got to kind of know the people to know where other people are so you can stalk them. So making those plans. So again, thank you so much, Amrita, and also Devashish. This was